So I'm here by Cameron's invitation. I also have adult children living in the home, two adult children and a granddaughter. We have removed a roof to add an extension, so it is quite chaotic here right now. That with my two dogs, four cats, technically five, but we won't count that one yet. I have a cosmic space around me, four or five cats. I have sworn I would never have five cats again. The last time I have five cats, and they keep rolling in. They just keep rolling in. Um, so I also have chickens, and I have fish in my pond that I also have a relationship with, as well as my trees. I have a relationship with all my trees. So anyway, I could go on, but if I keep going, this will not be very pretty shortly. So,
And you guys have to save some stuff for future meetings because this is going to be an ongoing thing.
oh, well, trust me, there's loads.
Thank you, Carrie.
Okay.
I think Cameron is the last person I see online. Cameron?
Hi, everyone. My name is Cameron Fisher, she, her, and I'm a board member. I have a dog, a 14-year-old Shepherd mix dog, and two very rambunctious cats, all rescues, and always very lively. Good entertainment.
All right. Thank you, everybody, for indulging that. And, we can discontinue that if you guys get bored, but it's fun hearing a little bit some personal stuff about you guys. And so we're going to move on to the agenda, which is the approval of the November minutes. We canceled our December meeting, and so November is it. And I think Dana distributed a copy of the November minutes, so I'm assuming everybody had a chance to at least look those over. So is there any discussion about the minutes? All right, I'm going to move to a vote. Do we have a motion? Anybody want to move to approve?
Motion to approve.
8 seconds. Thank you, Stephanie. Second. Any further discussion? I doubt it. So let's move to a vote. All those in favor of approving the November 2025 minutes, please say aye. Aye. Anybody opposed? All right, that passes unanimously. Okay, so moving on, I think we're actually on track now. We're going to move on to the director's report, and I think Shannon or Polly.
Me?
You guys.
No, you were doing it.
This is your last time.
Oh, here's long gone, Polly.
Yeah, I'm not prepared because I thought you were doing it.
Oh, well,
We can
yeah.
tag team it.
We
How
can
about that?
tag team it.
Okay, there's a lot. I mean, I don't want to spend too much time. Our main focus right now has been around budget. We are in knee deep in preparing the budget, and we've had a number of sort of unexpected budget hits that are both, a positive thing and a challenge that we have to deal with around pay equity and market analysis. So the county hadn't done a market analysis since 2017. So it's due, it's time, it's a good thing. We want to be competitive with the market. The health department, I think the total hit was around 10 million with benefits and everything to the whole county. Half of that was health services. So we're racing with that impact. It's a good thing for our staff though, so we will find a way through it. And then pay equity, of course. And then, you all know the number of other threats that we've got coming our way with both state, federal, and CCO reductions likely to come. So that's been primarily where our head has been. Sorry, I want to pay attention to the screen. So we are knee deep in creating scenarios for reducing vacancies and just kind of any strategy we can do to avoid, the worst case scenario, which would be layoffs, obviously. So we just rolled out a voluntary opportunity for staff to reduce their FTE, their employment status with us voluntarily. And so we're going through a process to see what that gets us. We're doing a hiring pause. And we have a lot of other strategies we're looking at behind the scenes and doing an analysis on. So that I would say is taking up the bulk of the time. The contract got negotiated with the state, so that is no longer a threat, which is wonderful. I think it was a good enough contract. for us to move forward. I think there's still some challenges in it, but you know, I think they're not happy with it. We're not totally happy with it, so everybody's not happy, which is, you know, usually when you know you did it right.
I think they're happy that they're not happy.
It's a good way of doing it.
So that's getting us in the process of getting signed, and that's an 18-month contract, so won't be surprised if in 18 months we're right back where we were, negotiating some of these key points. CCO, we're in the midst of our CCO contract negotiations. That's been a challenge. As you all know, CCOs are facing the same fiscal challenges that many others are facing. So we're already looking at reductions in that contract. We're negotiating how much, but that's a back and forth and likely to hit us in fiscal year 27. So we have kind of the immediate hits with CCO and sort of local stuff. And then we've got fiscal year 28 and 29 that will be kind of where the federal impacts that are going to come our way. So trying to do everything we can right now to set us up for success and manage what we know is coming. So everything we're working on, we're thinking this is not a short-term one-time fix. This is a long-term strategy that we have to live with for a while. So these FTE reductions, like, well, we have to be really thoughtful about which ones we approve, how we do it, because we're going to be living with it for a while. And so that's kind of, I would say where mostly my brain has been. I know there's lots else going on in behavioral health, but
Yeah, at the operational level, one of the things that we're doing is working with a company called MTM. It's a consulting firm. They are a national firm that works with behavioral health providers to look at access to care. So when we look at some of our regional health improvement initiatives that really talk about, hey, access to care is one of our primary areas. We're diving pretty deep into that. We're going to roll out what's called centralized scheduling. Our target is around the April 1st timeframe, which will aim to have efficiencies when somebody comes into services, they get an assessment, but oftentimes we lose people between the assessment and their first treatment appointment. Actually, only 23% of all people that we assess stay in for 5 or more sessions. So this model really ties into the budget because it is looking at, are we maximizing our resources? Are we, do we have unrealized service capacity, meaning that we can see more, or are we, do we have too many employees to meet the current model? So we're going to do that, which will hopefully tie into some of the budget shifts that Holly is talking about. It also works to be clear and upfront around our expectation of clients when they come into care. And then it brings in what's called an engagement specialist, a different position that we've never had, that when somebody is no showing appointments or not attending appointments, that instead of their clinician reaching out, this engagement specialist really works to find out why. Is there transportation concerns? Do we need to focus on social determinants of health, like have you eaten today? Do you have a roof over your head? And really work to resolve those barriers. So Kristen and the other managers have been very, very deep into this and are doing a great job. But it is a massive shift because it goes from our clinicians being able to kind of manage their own schedules to a little bit less autonomy, but it will actually decrease their administrative burden. And we had an audit in 2024 that kind of probed all of this. The timing of it's kind of good, but
internal county audit.
an internal county
Prior to
audit.
Elizabeth.
Yeah, that got feedback from our staff that said, hey, some of the reasons for my burnout is disproportionate caseload sizes, and not a standard in terms of being held around productivity expectations. And so this really also works to support staff by reducing administrative burden and having better caseload management and setting some standards across the board. So that's kind of the grassroots that I think efforts that I think play into our approach to supporting our community and despite all these.
Yeah. And the nice thing is we started this MTM work actually before we knew any of this was coming. So had we been starting it right now, it would be probably 2 years before we could actually implement it. So we're actually on the cusp of being able to implement it right at the key critical time we need to. So I'm really grateful for that difficult decision because it was an investment to do this work. But Kristen has done this work in her previous roles and really was like, we need to be doing this. Like there's more that can be done. So she was real instrumental in helping us kind of understand what all we could be doing.
Can I ask you guys a question about the scheduling? So what you said completely makes sense, especially for the providers and consistency. I mean, everything you said. So as a parent who experienced going, working with staff who were amazing, the person we had was super flexible and was able to meet my son's needs, which were like refusing to go to school, and he would show up and walk with him for a while to get him to go to, things like that. And I get how that directly relates like to burnout and like, and
Yeah.
that was part of what was so helpful and amazing.
Yeah.
So I'm just curious how you guys, like, I'm not saying I think it's a bad thing by
Yeah.
any means. I'm just curious because that is a piece to me who's experienced it,
Yeah.
that it was special, and it could have been that person, but I'm just curious how you balance.
So we're starting with outpatient, child and family outpatient and adult outpatient, which are primarily clinicians that are clinic-based.
Mhm.
My assumption is your clinician was not a clinic-based clinician.
What, I don't know what you mean.
What I
like
mean
they-
clinic-based is they don't often leave this office space right here, Courtney. So we have school-based health center clinicians that are in the schools. We have wraparound clinicians that go out into the community. We have clinicians.
Oh, he was a wrapper,
Yeah.
yes, sorry.
So
Yeah,
that
he
makes
would
more.
meet him where he was at, so
Yeah.
you're starting with the.
So
clinic.
we're starting
Got it.
here before we roll out to those other teams that have a bit of a different model.
Got it.
Because there does need to be some of that flexibility,
That
and we
makes
have some required approaches to care for like wraparound is a good
Right.
example.
Right.
Where we do things a little bit different,
Okay.
so that is a great clarification.
Okay.
This is starting with the hubs.
Okay,
Go ahead.
Yeah,
that
it-
makes sense,
It's
yeah.
also not, I mean, it's not completely rigid.
Okay.
The clinicians will still have the ability to communicate different nuances and different things for the different cases to the front desk. And so it's not like they're completely. out
They
of the
have
picture.
some
100%
autonomy and like
Yes,
this
and they can
particular person.
Designate certain things to happen if need
Okay.
be. So there, I mean,
That's
we
good.
have to have some of that flexibility
Yeah.
because we
Yeah.
do alternative kind of
Great.
things. So
I'm glad to hear.
it's
it.
just taking the primary burden of scheduling, which, if you think about a
Yeah.
clinician calling and the back and forth, like
Yeah.
they're in session all the time, it's really like, it's a burden.
Yeah.
And so taking that off of their plate,
Yeah.
but still giving them the ability to direct care.
That's great.
Yeah.
Sounds good.
Thanks for the question. That's like probably the number one question that comes up first from clinicians and staff, when we talk about a model like this. They're like, wait.
Yeah.
And so you're right on,
They-
you're right.
I mean, they all,
Yeah.
have that passion, right? But you
Absolutely.
can see both sides of it, and just, from the caregiver's perspective, like that was really a thing that saved us, and, was super helpful.
Yeah,
So
clinical,
you.
clinical decisions will always drive care. This just gives some structure around it.
Got it.
And, yeah. The last thing that I had is Holly is the health services director. And there's a shift, right? So Holly won't always be here. And then if you notice around the room, there's less managers. And so Melinda and I spoke about that. And so I'm interested from you all around, and it doesn't have to be today, but having that discussion about how BHAB looks in the future. Melinda and Lee have been and been to the public health version of this. And so we are open. Kristen is here representing, it'll either be Kristen or Amber representing the drug and alcohol aspect. I'll be here representing the behavioral health. But if there's ever a desire to have any of the managers back, we certainly can do that.
Are we still gonna have Paul coming?
Oh, not unless needed.
Oh,
Yeah, that's, so he's one of the managers. I know he sort of almost acts like a little mini director because he's the IDD world is.
Well, yeah, 'cause there's
specific.
Pretty. You would know too, for me, a very distinct split, and they made it clear to me that there was, I know that's over the years tried to change and
Yeah.
be less siloed. But there are very specific things that were.
Yeah, we really want you to be the driver of that.
Mm.
We are here and willing. You're our advisory council, and so if that's needed, we're willing. We also, speaking with Melinda, recognize that all of us in the room sometimes doesn't allow for like fluid conversation or open, honest conversation. And we really want this to be an effective meeting. So however you want that, we're willing to accommodate, except for Molly joining.
Except.
Sorry.
And maybe we don't care.
I guess my only thought is if we're gonna have, a QE kind of representative, it seems like we would have the IDD as well. Unless we just wanna go up, I do, and I also appreciate like less managers and. Like I'll talk no matter who's in the room, but not everyone feels that way, so I do appreciate that because I think it's important to have some other voices, but I don't know.
One thing
No.
on the SUD, it is a requirement, because this board is combined, we combine the two, so that's why that portion is there, just for you all to consider.
And we have a lot of work coming up, starting today and then over the next couple of months. On I call it, what do we want to be when we grow up, as BHAB. And so we have sort of a framework to at least start that conversation, and we'll begin that today. But I'd like to say congratulations to Shannon on your new position.
There you go.
County made a good decision.
Yes, thank you.
And then.
That was Holly's decision.
Good job, Bobby.
Oh, good.
Right.
Krista was there.
Yeah.
And then along on this, as we're talking about agendas going forward, because we're clearly changing how we function a little bit. Tony, it occurred to me that we sort of have just picked up the agenda, that format that we sort of started with. Would the county like to have, like we always ask for a director's report, would the county like to have some time? And if so,
Oh, I got a couple notes here already. Yeah, there we go. So just sense of place, as sitting county commissioner, what I can do, I'll be in Salem during this short session. So the things that become, a legislative ask or even federal ask that we can advocate for, I'll be available for that, and the board can get involved. We just signed a letter in support of public health, asking to make sure that their budget doesn't get cut. But the problem is the governor said, 5 to 20% discussion across all organizations. So the Board of Commissioners, the three of us signed this letter, knowing that this is probably going to come from about 6 or 8 different angles where we're all going to want to sign a letter saying, please don't cut our budget. I'm at the table at the Association of Oregon Counties on the legislative committee also. So AOC and Holly will be involved with this, and there's organizations for behavioral health, public health that are at the table also. I'm the chair of a public safety and veterans committee, which just gets me at the table for all topics, though I'll be a voting member at AOC. So that's 36 counties that all work together. So as I say, for this short session, but then I think of the next 12 months, the short session is going to come and go really fast. There's discussions about, yesterday we heard from Doug Riggs, our lobbyist, said that the state finances, remember it's a 2-year biennium, and they thought, we're $300 million in the hole. Oh, maybe we're only $60 million in the hole. I don't forget how many zeros and commas there are, but they said that maybe since the stock market's going up, that people took capital gains, which is going to be paid to the state, which maybe it'll be kind of balanced better than we expect right now, but we don't know. The next revenue forecast is in a few weeks at the state. So, but my point there is that it's going to happen fast. 30 days of a short legislative session is just going to come like a freight train past us. And in the next 12 months or so, and however many times we can meet in the next 12 months, this is the time to set up for that next session too. So the state talks about, we're probably going to be in a flat or negative biennium financially for the next 3 to 5 years. I mean, 2 biennium is 4 years out. And it's just the way it is. Things are just changing drastically, top to bottom, across the country and then in the state also. So that's what I think of, as a commissioner. Another little update: Michael Schultz is announced his retirement, so he's captain at the jail. So he's captain at the jail. Michael Gill is acting captain right now, and so his July 1st, I think. So he's another 5-6 months, but sheriff told us yesterday that he'll be on Marine patrol for the last few months.
that's a
Poor Captain Schultz.
What do we
He has
know
the
about?
credentials for that, so he's gonna grab a pickup truck, boat, and go out to wiki up and just ride around in a circle and wait at people.
That's a good way to fill in the retirement.
The sheriff said that the way that works is that they have state Marine Board patrol money. So it basically helps the jail not have to pay for his position, because he'll probably want to take time off if he has any extra time or whatever. So, but yeah, Michael Gill is the acting captain for the jail, which we'll invite him to this.
Yeah, so I don't know, Michael's a voting board member
Uh-huh.
for us, and so it'd be nice if
Captain Gale,
Captain
Captain
Schultz
Schultz, yeah.
could come in. Yeah, okay,
Yeah, so that'll be an action item for us. And then, as I say, when we signed an advocacy letter from Public Health recently, Tom Kuhn said, okay, now the advocacy board is gonna go back and sign the same version of a letter with everybody's signature on it. And we thought, how do we do that? You know, so what's the legislative authority of a group like this? Because we've asked the Board of Commissioners, you know, we are kind of the, there it is. You know, that, you know, when the Board of Commissioners is taking everybody's input, making a decision, that's kind of position of the county. And there's associate organizations that may take a slightly different position. And there's the Association of Oregon Counties that have the lobbyists that are in the Capitol, trying to talk to legislators directly. So let's just all work together during this session.
and we'll be having some conversations about our advocacy positions and how we wanna function on that. It's hard to be nimble when we meet once a month. And I do think that advocacy positions, we need to vote on as a board. I don't think that that is a decision that any one of us can make independently on behalf of BHAB. Doesn't mean, however, and I talked to Tom, that really volume is probably more important than content sometimes,
Mhm.
like the quantity.
I
and
mean, the louder you scream,
yeah, the more people that
Oh,
get
the
it,
more people,
the
yeah.
more people, yeah, that legislators don't necessarily read the content carefully of every letter, they just sort of count up who's for, who's against, and how many people fall in each category, and so one way that we'll talk about, we can do that, and it's not on today's agenda, we've got some work to do before we get there. But we can certainly act as individual people, and we can provide you with the tools that you
Yeah.
need to do that, including template letters and very explicit instructions about how you submit advocacy letters one way or the other. And so at least one of the things what we'll do is be working to inform you so that you can act nimbly as an individual, even if BHAB because it would be just one letter from BHAB, right? It'd be nicer if we had 12 people providing letters, and so we'll have some more conversation about that. I don't know that we're gonna be very effective in the short session, because as you said, it goes so
and
fast.
maybe just, even if it's just one topic, get organized,
Yeah.
it'll matter. You know?
Yeah.
And our lobbyist, Doug Riggs, he's the one, and he just sent an email today about the topics that are just starting to be talked about in the halls of Salem. So we just need to keep our ears open, because there may be a moment where like, hey, by tomorrow at noon, you need to have this thing, because you're having a hearing on it. And it really matters, you know, on any topic.
Yeah,
So we'll work together.
yeah, you know, I guess I get hung up, and part of it's because I'm a lawyer and I represent public bodies, meaning school districts, and so I'm very well versed in public meetings laws, and I wish I wasn't, but I am. And so I just don't think that we can take an advocacy position unless we have an affirmative vote of the board, and we can only meet on, I mean, you can call special meetings with 24 hours notice, but then you have to notice them, you have to live stream them. You have to, you know, it may,
So,
Well,
a vote electronically now.
as far as I know, I have a difference of opinion. And I've been in communication with David Doyle on this, just to make sure we know what we're doing. Is compliant. I don't think I think that there are some other advisory boards that don't function this way, and that's why I wish I didn't have the knowledge I have in public meetings. It's a little,
I didn't know.
I looked it up after you and I talked, and I was like, oh, she's right.
I'm pretty sure I'm right.
Yeah, but for public meeting, you have to very specifically, that's the
Yeah,
difference.
you can have a regular standing meeting, which is what we have. You can call a special meeting if you provide notice to the public 24 hours or more in advance. But it's a meeting and we all have to attend, and you have to have a quorum, you have to be able to vote. And you can also have an emergency meeting, which doesn't require the 24-hour notice. However, the circumstances in which you can call an emergency meeting are limited, and I'm not sure needing to take an advocacy position justifies an emergency meeting. I also have questions about whether we could actually pull this group together for a special short notice meeting, and that's why I'm trying to find ways that we can be good advocates without violating public meetings laws. And again, it's probably just me, and the risk is probably very low, but this is a public meeting, and there are journalists out there with whom I'm very familiar And I won't bore you with the unfortunate circumstances of that. But there are journalists out there that are all over the public meeting stuff. You might want to look at Kirk County. Yeah, and so I'm personally not willing as the chair to risk.
Yeah.
Any kind of.
Well, and I think your approach could, it could actually even be more beneficial
Yeah.
with the volume of letters coming individually versus one letter that
Yeah.
might not lend the same weight.
Yeah.
So, yeah.
That's kind of my thought.
Well, the Board of Commissioners, we meet Monday afternoons, generally at 1 o'clock, and then Wednesday morning at 9 for regular board meetings. We can always have another item for a legislative topic. And we're meeting weekly on Thursday morning, so we're gonna meet 3 times at least a week on this.
Short session.
And we're publishing a schedule, and as I say, under other items at the end of the meeting, if we have something that's coming. We may or may not take a position on it instantly, but we'll share the information amongst ourselves.
Yeah.
So, and if it's, health related, they'll be right at the table too, so we'll be able to
Yeah.
communicate.
Yeah, so we'll figure out a way, but that's one of the things that we need to talk about what we want to be when we grow up and how do we function. On that, and then Tony, I think that on our ongoing monthly agendas, I'll add, we've got the director's report and I'll add a county report. How does that sound? Okay, all right, where are we? Anything else, directors, commissioner? Okay, so,
I guess, yeah, I'll try to, even if I couldn't make it, I'll send something, because
Yeah.
that's the only other way you can do it, because as I said, I think about November, I just couldn't make the meeting, I
Yeah.
was somewhere.
yeah,
But I was watching it, yeah, maybe, yeah, that's what it was.
well, and that's true for managers, for
Yeah.
you and Amber and Shannon, I think we'd love to have you come and give us an update because you're kind of the glue that binds us. But for the Drug and Alcohol Committee report, as I
Yeah.
told Shannon and Holly, it's a short report, I imagine. Maybe not, and you are always welcome, but I also, we want to be really mindful that you guys have big jobs. And coming to sit in an hour and a half meeting to do a very short report, that's not something I feel like we want to impose on you, and so you make that decision, but if you ever want to send Lee and I an email with your report, and then I can just read it too. So I just want to free you guys from the obligation of having to come to these monthly meetings when you may have other things to do. Having said that, you're here and we are at the time for the Drug and Alcohol Committee report, so I will turn the floor over to you.
I guess I'm also curious about kind of what all you're interested. And there's a variety of different things that we could report out on. And so, I don't know if there's time to have a brief discussion, or maybe it's something
Sure, yeah.
about what specifically you're hoping this year.
Well, we are now legally responsible for the Drug and Alcohol Committee. And so my view is that we just need an update about what's happening with your work with Pacific Source. And so I envision just a pretty quick, here's what's going on. And some months you may not have anything. And some months there might be earth shattering stuff. And some months it's just a quick report like, hey, we met in December. Here are our actions. Anything that relates to what we're doing, I think is my thought. But board members, please chime in. What do you want to hear from Kristen and Amber about the drug and alcohol responsibilities that we've taken over and that we've absorbed? Anybody? You're outlined it. Well,
Yeah, I mean, I think our goal is, we think about behavioral health, it's both substance use and mental health. And so like we wanted to have a balanced conversation around it. So anytime there's anything that's about co-occurring, I think would be really great to help bridge that gap. I think there's a lot happening. There are lots of a little bit more specific requirements around the LA DPC requirements. And so I think that could be a future agenda item where we sort of make sure we're hitting the mark. I mean, there's nothing that you all have to do. It's more of like what all you need to be helping inform or advise. I think Measure 110 funding type stuff is part of it. There's some other things in there that we'll just maybe bring to the forefront, talk about, make sure we're hitting the marks. And
That would be helpful for,
Yes.
yeah, that would.
Okay.
that would-
yeah, and I don't know much about it. I need to bone up on what those responsibilities are and how that impacts PHAB. And then trickles down to what report you might need to bring. And so maybe I'll
Exactly.
just have
That'd be
a
helpful.
phone call in between board meetings and kind of figure out what this looks like. But I
maybe
imagine
you could join your next one-on-one.
that's actually a really good idea. We typically have a meeting once a month with the director, just kind of in advance of the board meeting, saying, hey, what do we need to know?
That's
And
great.
so if you could maybe join that, and then you could even share with me then, if you don't wanna come to the meeting, you can share with us how we can report out, cause Lee and I are both in those meetings generally, and
That'd be great.
yeah,
It would be
okay.
great too if you could send out the requirements so we
Yeah.
all know what we're supposed to.
Within previous meeting,
I'm
I'll,
sure,
I'll-
we
but I'll-
talked about it, that,
we
yeah,
did,
it's
then,
quite a
and
while
we got all
ago,
hung
but
up in the CFA,
And
and
then
so, yeah, we
Yeah.
could pull up that OAR that we were kind of using before, and have it.
oh, great.
It's nothing too extensive, so when I say there's more, it's just that the
Yeah,
BHAB has,
to be able to give feedback,
Yeah.
to say what's important.
well, the BHAB has like almost no requirements.
Yeah.
So it's like,
Lee, you have your hand up.
Yeah, some of the things I think would be helpful for some members, because how we handle this has been a topic for a few months now, right? If we could hear a little bit on what the treatment providers, whether at the county or some of those Measure 110 burn partners, are doing for deflection from their perspective. We got Captain Schultz's perspective a few months ago on like how it works now from their angle, but we haven't heard from the clinicians who are a part of that network yet. So how are they handling deflection? What's that look like? Whether it's a report or these people are doing it. Just some similar things, big themes like access to care would be good to know. The peer mentor services available, just those kinds of things in terms of what might come up at other meetings that might help some of our board members and past conversations for bridging some of the education and like things that they may want to know about might be good also to hear when you guys are checking in.
yeah, I think the one thing around deflection that gets confusing is that it really got, well, I don't wanna say separated, but it's really managed by the sheriff's office, and then they contract out with Ideal Options and Best Care. And so our role in deflection is pretty minimal, because primarily that it's a criminal justice focused intervention. And so where we're sitting, I think Nicole Keefe sits at the table of the community partners that sort of talk about the system. But when it comes down to the day-to-day of operations of deflection, the county has pretty limited involvement. Other than the stabilization center that might have some interactions with people who are in that system. So I don't know, we'll have a ton to offer on deflection, but we could certainly have Nicole Keith come and talk about what she is involved in. She's the crisis program manager.
Well, even just explaining what's connected to what.
Yeah.
Right.
Yeah, yeah.
You know, even if it isn't the responsibility, it's like, well, this is where this goes.
Yeah. Yeah, that'd be great. And then I think, yeah, I mean, Kristen has a ton to offer around what the county is doing around co-occurring disorder treatment with the Cosmos program.
Right, I can speak to that. I could also, so we have the monthly SUD forum that happens that Pacific Source convenes. I can give, in that, I can give some statistics for that, I can give updates on providers that have presented. I don't know if that information is helpful for you. But, we have over 40 different providers that attend that meeting, and each month it's, something different, but the purpose of it is for us to connect and to share information and to work together on trying to support people throughout the community. So it's interesting and helpful, but I don't know if that's kind of information or I don't know.
I think that
I would love to hear it.
Yeah, you'd love to
Yeah.
hear it. Yeah, and then just let me know. I guess I'm gonna defer to I think we'll defer to your judgment, because
Okay.
I don't know what you're doing. So it's hard for me to tell you, here's what we want from you, other than our requirements under the OAR, which I'll dig into, and we'll put that on the February agenda to kind of refresh our memory about what we need to do. But I think we trust your judgment to say, hey, you've been part of this group for a while, you kind of know what we're doing. So I trust you to bring to us something that you think is relevant.
Yeah, I could bring a summary of, because we learn a lot. Every month at these forums, like when a provider presents, there's something that we all learn from it. Like there's been providers I didn't even know existed in Deschutes County, or that are new to the county and developing new programs that like many of us aren't aware of. So I can present a summary of all of that kind of information that may or may not be useful to you. But
Yeah, and it may just present what you think, and then as you present it a couple of times, you all may say, actually, we don't really want to need to know about that next time. Yeah.
Or something to follow.
Yeah.
Something to follow.
I think the 30,000 foot view here is that we're evolving
yeah,
as a board, and so we're trying to figure out what works for us, and it's gonna take a couple months before we kind of get, our wheels under us and are smoothly operating. So we'll just see how it goes and bring us what you think is important.
Okay.
Yeah, and never be afraid to ask, because we probably have it in some way, shape or form as we go through this.
Do you have a system of care like map for SUD services throughout like this region?
Would that be great to develop?
It would be like
That
from
would be-
another provider,
absolutely,
like it would be
yes.
like, okay, where, it's kind of like sometimes we're throwing a dart.
Yeah, because we do
Always
have one for like behavioral health.
We discussed at one time around doing a SIM mapping process for substance use.
Oh,
Are you guys familiar, sequential intercept mapping? It's just, it's a process by which you map out all the resources in your community from like the pre-treatment all the way to kind of like the most extreme treatment, like in the behavioral health world, like, criminal justice system or, or, secure residential, but it'd be like, it was a process to do for substance use disorder, which is an interesting idea, and Gobi actually does, mapping like that for free.
It'd be cool to see, like for our region, right?
Yeah.
To see where we have duplicates.
Yeah, totally. Pacific Source should do it, but
I will.
send a link on Gobi. I mean, sorry.
All in favor?
Yeah, we can ask Kelly and if they have, whether they've got the bandwidth or the resources now to tackle something like, or even the expertise. I don't,
Yeah.
it's like one of those process mapping exercises that I'm not sure.
Gobi specifically
has
has trained
specifically,
to
like,
do
do
it.
it, to do it.
Yeah. It's a pretty.
It's extensive.
Well, and a
Specific.
preview about what's coming up in this meeting in the next couple of months. System mapping, resource mapping is one of the options that we're gonna talk about what our function might be in that. So stay tuned. I think this is gonna be a really good discussion.
And then the other piece, of course, I can update you on what we're doing internally in our behavioral health programs, specifically around the Cosmos program, because that's our newest development.
What is that?
Yeah, it's our level 2.1 intensive outpatient co-occurring program. We started a pilot last spring.
PCHC requirement.
Yeah.
Intensive outpatient for dual.
For dual. Yes, specifically for dual.
I'm having a hard time following it, and she's getting all the time.
Cosmos is an
Yeah, which I remember Michelle,
co-occurring mental health, substance use.
Something, right?
I co-occurring and I'm like, oh.
Outpatient services,
Yeah,
there you go.
it's in there.
How do we get people in?
Just through a regular access process that they get identified through access and get referred into the program or internally, or you can contact us directly. I mean, we at the Sud Forum, this is where we're doing a lot of work with our partners. And people can reach out to Michelle Adams directly, who's the program supervisor, and talk through cases and get people in that way. So it's a small pilot. We have one therapist, 1.5 FTE for therapists. We have a case manager and a peer support. We work collaboratively with the rest of the adult outpatient team, but that's the Cosmos team. They're all mobile. They go out in the community. They do whatever we're needing to do to get people engaged in care. As of right now, we have about 30 clients that are enrolled in our program. Not all of them are at the 2.1 level. Some people have barriers to being able to engage in treatment at that level. It's 9 hours minimum a week for that, 9 to 18 hours a week. So some people have a hard time being able to get that many hours a week. So we're working on that. We're just kind of looking at how we have it structured over the last few months and how well that's working. And we're currently starting to develop our second phase to build in a little bit more structure and strengthen the treatment of our programs. We're learning a lot from the folks that we're working with. One of the biggest things that we're really excited about is we have done a lot of work in getting people into higher levels of care, which we've all done throughout behavioral health. But with this particular program, we've been very successful at getting people in and then catching them when they come out and really staying connected to those residential providers so that we're actively planning before the person is coming back out into the community. So they're coming back out to Cosmos, we can wrap around them and help them on their journey and recovery from there. So that has been a huge thing to strengthen those transition points where we know we lose people. So we've had some great successes with that so far.
And you're tracking that.
Yes.
Yeah, because I think that's gonna be a new requirement of CFAA anyway.
The coordination piece?
Residential track.
Oh, really?
Yes.
Well, that's great.
Yeah, no, it was just like, because I was like, oh, we can't do that. We don't track that. And I'm like, now I'm hearing
Yeah.
that we at least do somewhat.
Yeah, the way
Yeah.
that we're Tyler has put our data out, we can see when someone goes in. And we're keeping cases open so that we can continue to coordinate and continue the communication. If the person ends up dropping out of treatment, where we go after and try to capture them. The flexibility of this team to be able to do that work has made a big difference. We just need to kind of do the next layer of the clinical programming and a little bit more structure. Our clients are needing a little bit more structure than we were originally providing. So, and then we're also starting in the child and family, the Cosmos Junior.
Junior.
Cosmos
Junior.
Junior.
Oh my gosh, guys.
17 and under.
Yeah, and so.
That is a brand new pilot started this month. It is only for individuals in intensive use services right now. But if you were, if you referred someone to intensive use services,
Then I could.
then
Okay,
they
so if
would
we
be
have
assessed.
some-
But what we're not doing is opening it out to the hubs and to outpatient. We're using the 2 burn clinicians that we have for young adults, as well as our YAC clinicians. So our structure is just, the process is the same, the staffing model is a little bit different. Because those teams are already community-based, where Kristen's teams are here. So they'll be well poised to go out to Lapine and Redmond and child and family outpatient. Right now, they're just starting and they're working the process. So they just started this month, so they're behind, and we just really stole Kristen's all of her hard work and said, yeah, look, it's done.
And I think the cool thing about this is that, so CCBHC put out new requirements, and this was one of them that you had to opt 3.1 level, or get a DCO with a community-based provider. And we really, weighed that decision hard, because it sure would have been a heck of a lot easier for us to just say, hey, Beth Care, you want to do this? Or hey, so-and-so, you want to do this? And instead, Kristen and others really said, we want to see if we could, because we have a special population that often doesn't do well when we contract it out for, because it's just not the population those organizations often are used to serving. And so our expertise with serving severe and persistent mental illness, and then building this expertise to do the co-occurring, was really what we felt would be the best for our clients. And so it was a lot of work, though.
We asked our partners at the forum prior to start making the decision that we were gonna do this, and we proposed it to all of them, and they were just like, please. The other providers that do it a level 2.1, which is substance use specific, they were like, please, we need the mental health component. And so, we realized at that point that there's a gap in the community, or specifically for co-occurring.
Do you know who's on there from the hospital? I can't remember if it's Jillian Sultan or Shane Coleman.
From the hospital?
Yeah.
I don't
Or
think
anyone.
anyone's there.
Oh, we gotta get someone.
I don't, St. Charles.
I was like, why do I not know about this? But
Yeah, no, it's,
okay.
we meet, I can send you the information.
yeah,
I'll email you.
that'd be great.
It's a great meeting.
Oh, good.
Good that you got here.
Huge kudos to you guys, but especially you and your team for creating this. I know how much work that can be, and it's such a need for the community, and I'm really excited to hear about it. So great.
It's been really
great
fun.
work.
Oh my gosh, we're learning so much.
Yeah.
We're trying to do this a little differently too, just to accommodate to folks with the severe and persistent mental illness, because traditional outpatient substance use, the outcomes aren't great. And so we're really trying to figure out how to do it a little different to see if we can improve that a little bit more. So far, this is pretty good. Yeah.
Deschutes County just out of the game.
Great.
Yeah.
All right, so we're about a half an hour behind schedule, which is fine because, because one of our agenda items is gonna be an ongoing conversation, so we'll just get as far as we can, but I'm gonna switch the order of the agenda on, to facilitate that a bit. Our next item, though, we'll stick to, and that is voting on a new member, Carrie. Cameron, could you please take over and present Carrie to the group, and then we'll take a vote?
Sure.
Cameron,
Okay.
I'd love to have Cameron start to introduce Carrie.
Okay,
Do you want us to
I'm
vote
super
you?
excited. I am super excited that Carrie showed interest, and she was quite patient with our process because we had hoped to interview a few folks kind of in the same round, but so I appreciate Carrie being super patient. And she has so much to bring to this group with regard to not only lived experience, but also professional experience, and a longtime Deschutes County resident as well, and just some real passion. So, and Stephanie and I touched base. Stephanie supports this appointment as well. And I think I'll just let Carrie maybe share whatever you're comfortable with, Carrie, about yourself.
Oh my. I'm not quite sure what to say here, other than I have a long history, personally and professionally in mental health. And I think as a society, we need to value it more. And I think that is my primary goal. Both with financing, we need to put money behind it and find ways to hopefully find better funding and for all of our patients and all of our families. So I don't know what more to say in the moment. My head's a little foggy.
Carrie, what's your last name? I should know this and I don't.
McKinnon.
And what do you work or do you have what's your?
I'm currently retired. I'm a retired nurse. I guess I just assumed you all had this information. I'm a retired nurse. I worked worked medical, chemical dependency, and psych. I volunteered in high school in psychiatric settings, being of my age, settings that you wouldn't be able as a high school student to volunteer in. So I saw some pretty intense things from a young age, but I also grew up with that. Very close family members with schizophrenia. My mother was agoraphobic. For some reason, my community happened to be pretty laden with some mental health issues. They were lots of family involvement and support, help families to get through that. So I was able to witness that in a system where there was funding. So I think that's probably my biggest passion, because I know everybody working in mental health is in it with their hearts and souls. And if you don't give people tools and you don't give people the funding to do what needs to be done, it makes it very difficult. So that's my thing, is that I would really like to see, every time I go to a political event, I always ask a question about funding. I think it gets lost in the mix in our politics, and we lose sight that we are talking about real people and real families here. So there it is. I'm probably rambling. Like I said, my head's a little foggy right now.
Carrie, thank you for giving us your introduction to yourself. And thank you to Cameron and Stephanie for your efforts to speak with Carrie and present her. And so at this point, I will open it up for any discussion, possible motions. And our motion would, if somebody's so inclined, the motion I think would be to recommend her make a recommendation to the county to appoint her to the board. I think that's the proper way of saying it. So
I'd like to make a motion to recommend Carrie to be appointed by the Deschutes County Commissioners.
I'll second. Molly seconds. Any further discussion on this? Anybody have any questions for Carrie? All right, besides the fact she's got 5 cats, we know that. Her sisters.
Belinda?
Yeah?
Yes. Just to pop in, I didn't know how much to share with regard to Carrie's application, so I just kind of left it what she wanted to share as well. So, but if anyone has further questions, we can discuss.
Yeah, that's sort of a procedural subcommittee question. Cameron and Stephanie are on the membership and onboarding committee. Peter was, but he's no longer with us, I think, starting this year. And so they were the ones that identified Carrie, and I assume you guys interviewed her. She had an application, so we followed the procedural steps. So I think we're clear on that. So if there's no further discussion, I'm gonna put this to a vote. We've got a motion and it's, what?
Linda has her hand.
Oh, Linda, you got your hand up. Sorry, I can't, it's a little icon, so I don't see it right away. So
It's a little hard to see. So I have a question. It's not meant as a trick question or anything like that, but as a newer member, I've been, listening and learning and formulating. And so I'm curious, and it's not a right or wrong, from what you've learned so far and seen and observed, if you could say in 20 words or less what the current, not what it should be or could be, but what is your short answer of what you think you're volunteering into and why?
good question.
Oh, that's a good one. And I'll
Sorry.
do my best through my fog today. Well, I do, I see it as an advocacy position. To me, this group is there to support the people that are on the ground. And what I hear from people, I mean, I'm just so impressed with everything everybody has brought to the table and trying to deal with, again, the funding cuts, et cetera. So, I personally see it as how can we best, for me, how can I best support the process of people that are doing the work and that are engaged. And, again, I always come back to funding. To me, it's all about getting the funding. And obviously, personally, I don't have control over that, but looking at where the needs are and how to plug in there. So
I
did I
guess
answer that question?
I don't know if you did or not, but if somebody were to ask me, you're on the eight, I've got to look at my initials. I am on too many committees.
Right.
Anyway, Behavioral Health Advisory Committee. If I was just at a dinner party or having coffee and somebody said, "Oh, you're on that committee. What do they do?" I don't think I could boil it down into 20 words. And I'd like to be able to do that. And when I come as a new person, I hear a million things going on, but what would that be if it were short and sweet as a group? And that was my question.
Well,
that was my question.
And that's the work that Lee and I are trying to lead this board in doing, because we inherited kind of the status quo, which was fine.
Yeah.
But I'm not sure that's where everybody wants to be. And so we have work to do as a behavioral health advisory board to talk about that. And so that's what I was referring to. Lee and I have planned a framework
Okay.
to discuss what do we want to be when we grow up, so that we can answer that question, because I can't answer that question either in 20 words or less.
Okay.
For 100 words or less, I can do that. We need
And
to,
that's why I was asking Carrie. She might have come in with an inspiration just out of the blue that would be perfect. So thank you. That was my question.
I wish I could be that inspirational. That would be really nice. What I can tell you is that I have a lifetime of being an advocate and being a patient advocate. And I have learned that that is not something that I can let go of very easily. So I am hoping that in some way I can bring that energy here to benefit a population in need.
yeah, and we'll just
And
need
to
to ask
support
for your,
those that are
we'll
doing
need to ask for your patience, because this is a work in progress and we are
I
evolving.
get that.
But so we're doing a
I
lot of
get that.
organizational work first and housekeeping work first, so we can actually get our
Right.
hands on some of the work that
I-
you're talking about. So
I understand the management piece and everything else that goes into it. So I do get that.
So we are 40 minutes behind on our agenda at the moment. So I am going to put this to a vote. We have a motion, Cameron moved and Molly seconded to make the recommendation to have you join BHAB. So I'm going to call for a vote now. All those in favor of inviting Carrie McKinnon onto our board, say aye.
Aye.
Aye. Any opposed? All right, motion carries. And Carrie, thank you for joining our board. We look forward to working with you.
Thank you.
All
Thank you.
right. So we come to the part we're going to swap agenda items. We have an agenda item about our meeting schedule. And part of this is what we want to be when we grow up, but we need to start talking about like what our schedule looks like, what our meeting format looks like, and whether or not we're going to continue to expect the county to provide us lunch, which they have done, knowing that we are facing pretty significant budget constraints. It's pretty small expense, but it is an expense nonetheless, and we, you know.
Told you, Commissioner, we're looking at everything.
That's good, yeah, top contender right here, this is good.
Yeah.
So under our.
And jelly.
So we have traditionally met year-round, every month, which is fine. We've had a couple of cancellations this last, I don't know, 6-month period. And we don't need to talk further about this, but I want to plant the seed for further conversation about this as to how many meetings you guys feel like we need to have in the course of a year, how long those meetings are. Would you rather have every other month, 2 hours, or is every month for an hour and a half? I think we need an hour and a half. I don't think we can get this done in an hour for the most part. Do we want to alternate virtual with in person? Do we want to do all virtual? Do we want to do all in person? And importantly, can we let the county off the hook bringing lunch and be responsible for bringing our own lunches or having eaten first?
Or move it to a time that's not during lunch.
Exactly. And so this may, given that we don't have a lot of time, and I want to present to you the menu of options for what we're going to be when we grow up. I don't know that I want to get mired too much in a conversation about that right now, because that could take us to 1:30 and then we won't have any time. But how about we leave it at that for right now, but to the extent that we're gonna ask, we're gonna continue meeting. Tony, do you have something to say?
Just a thought, maybe a structure, so sometimes we're having a remote meeting, sometimes we're having a hybrid meeting like we are today. Maybe there's a meal or two in the 12-month period and it's promoted to have an in-person meeting. Because as I say, some of them are virtual only also, so.
So alternate.
Yeah, I mean, 2 meals a year kind of meetings where people are trying to get together in the room, because it's so valuable to be in the same room instead of just online too. That's just what comes to my mind.
Any other discussion thoughts?
I like in person or mixed, and I don't need to. But if we're doing maybe a longer meeting.
It'd just
Or
be a
2
special,
times a
yeah,
year.
exactly, once or twice just for the kind of special, today there's a meal.
And food does bring people together. So
Yeah,
I know it
yeah,
also
it is.
diminish the
Depends
value
on who you
that
set
the
it
food actually does bring. It's not just like nice to do. It actually is very lovely for connecting.
And I think as a reminder too, there's a lot of people who are here not on behalf of their jobs and aren't being paid for it, and I just want to respect that. So when we do it over a lunch hour, I think we should be cognizant of that and figure out ways to save money. So yeah, I think it's something we should consider.
And if I could just
I,
add, as a, I'm sorry, Cameron,
no, it's fine.
as a family member, I can only attend when I have alternate care for my child. So having a hybrid meeting allows me to participate.
Agreed,
So.
yeah, agreed.
I like the hybrid
100%.
too.
Anybody, Cameron, what is your thoughts?
Yeah, I was going to add, I think it's essential to always have virtual option, but I also totally think it's fine to be able to designate. Oh, did I just get booted? Oh no. The other piece about food, I really do believe that food not only brings people together, but the other piece is that there are a lot of groups like this where people are getting compensated, whether with a gas card or with an Amazon card or a cash card or something. And I think food, it doesn't have to be a big spread, but just something I think is a nice consideration for folks who aren't here on behalf of their work and don't have tons of resources too.
I'm curious, for people here, how many are here because of their work?
It's part of my work, but I would be here if I was.
I'm honored to be here, but.
Yeah.
Yeah. I'm here personally, I'm not getting paid for this, it's Stephanie, are you?
No.
Linda, I doubt you are you?
You're on mute, Linda.
I'm just curious, I hadn't even thought about that, I'm just curious about it.
Oh, I'm a foster home provider, adult IDD, and so our guy is consumer of services, so we need to know what they are. And then I'm also on a couple of other county committees that are looking at understanding what the needs are and what changes need to be made and communicating to the state and other agencies. So
Sorry.
I'm not directly paid in a titled job to be here, but it's a result of being plugged into the foster community
Yeah.
and mental health
we're all
services.
hearing Some professional, we have some interest in this through our profession, but I just didn't know if there are a lot of us that are being paid to be here versus those of us that don't have. Okay.
Nope.
Cameron, you're here in your personal capacity?
Both actually, just because I teach future counselors and social workers, but definitely here, number one, as personal capacity. But I think there are a lot of people who wear multiple hats, even employees of the county. But I also, we do just a plug again, which I've said every meeting, talking to more people who have lived experience that can bring some of those valuable family insights, community insights, because we do need to be over 50% of those members. So that is you.
Yeah, I think we're there. I'm not concerned about our percentage of members with.
We need one more.
Huh?
I think we need one more.
Yeah, we need more members, but I think that it's pretty easy to satisfy that lived experience criteria. Okay.
I think we're seeking two prior to Carrie. And so Dana, correct me if I'm wrong, but I think we needed at least two to meet that criteria. And so now with Carrie, we're still needing one more person who had lived experience.
Okay, I guess we're
I
gonna.
might add, excuse me for jumping in, I have a professional background in organization development, blah, 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 blah. And so even though it's not my front and center reason for being here, it is a skill set that I'm happy to share and use and volunteer with.
Okay, thank you for that, Linda. Okay, so I think that for right now, I'm hearing that food is important. Maybe, but I'm hearing that maybe targeted meetings where food will be provided and we just provide you guys notice, but it's not every time. Maybe 1 or 2 times a year. And so right now, I don't want to get into a conversation about schedules and what works best, but we'll try and include that on a future agenda. So please be thinking about what works best for you. And feel free to email Lee and I, by the way. That might be the better way to kind of look at it so that we're not spending a lot of time in a meeting talking about everybody's calendar. So why don't you try and remember to email us, like what's your preferred time, date, that kind of thing. Okay, so I'm gonna move on because we have 10 minutes now and it's changed kind of how we're gonna be doing some things. Dana, I think you emailed out the menu of potential future directions for BHAB.
I did, I emailed it and we have some other copies here and
So I have another meeting down the drive.
Okay, thank you for
It's great
coming.
to see everybody.
There's 3 sent your way. So as we're, and those of you online will have to refer, I don't know, Dana, do you have stuff? Okay, so she's gonna share a screen with this.
Thank you.
In November, I reported to you that I joined FAB, the Public Health Advisory Board. They had a retreat in early November, and Colleen Sinsky is the director, and they have Tom Kuhn, who is kind of their director. It's like their, executive director, and then Colleen's the chair of their board. So they have a resource, and I don't mean to sound like we don't have this resource, because we do, but they have a director that kind of drives their ship a little bit more. And I think for us, it's the chair and the co-chair. But what Colleen did is presented something similar to this. This is her brainchild. I cannot take credit for it, but it's a menu of potential future directions for our board. They are going through the same process of trying to think through, well, how do we want to function as a board? What do we want to do? What do we want to be when we grow up? And so Colleen came up with this, and I thought it was sort of a brilliant way to create a framework for the conversation. So I'm not going to go through this because I don't think we have time, but I want you guys to take a look at this, be familiar with it, and come prepared to discuss it, because there's some options for how we can function. And the first one, just very briefly, it's set up. Option 1 is to maintain the status quo. That is to continue with our current structure and rhythm. We meet monthly. We focus on updates from the county and from the board. We bring in, community partners and people to come present to us. And then we do some committee work as needed. It's the status quo. And in practice, each of these options has an in practice. What does this look like? I won't read over everything because you guys already know what we've done. And then there's a section under each option for pros and cons for that option. The second option on the back, second page is, you know, more advocacy work, establishing a rapid response and policy advocacy committee. Again, there's in practice, what does that look like? Pros and cons. Option 3, I'm just going through this real quickly so I can get you out of here on time, is form priority area collaboration groups. Option 4 is to use BHAB as a forum for system mapping and alignment. And that's what I was saying. We talked about that with substance, the SUD work. It could be broad, I would imagine it's broader than that. You know, we don't want to recreate, you know, reinvent the wheel kind of thing, but maybe we have a role in trying to create a system map so it's easier for people to understand the various programs and services and how to access them. And then option 4, or option 5 on the back is strengthen BHAB's role in nonpartisan education and public trust in behavioral health. And so that's more of a public facing function that we would do. And so obviously I'm not going into any detail, but I would like you guys to read through this. These are not the only options that we can consider. So if you have other options and ideas, let us know. And we can also make hybrids of these. It's not like we can only choose 1 or 3 or 5. We can kind of create and do whatever we want. We can be what we want to be, knowing that we are an advisory board that serves as a vector between the county and the department. And they are our constituents as well. So primary constituents. So anyway, I thought this was a good way to have a conversation moving forward. Lee and I envision that this is a conversation that's going to continue. It's not like, you know, it's going to take several months for us to kind of work through this and have some really good, thoughtful conversations about what do we want to do? What does this look like? And so it would be helpful if you guys could read through this with some detail, maybe now, so you know what we're talking about, and then maybe right before our next meeting in February, so it's sort of fresh in your mind, and be prepared to have a conversation about that. You guys have any questions? And you know, if you have any other ideas, other frameworks that we could use, this makes sense to me. I thought this was a really good way of starting our conversation.
I like this a lot, and I would say everyone should read the bylaws too, because I think we
Thank you.
overlook frequently that we have things written down about what our directive is. We are an advisory, that is our role. So I think this paired with the bylaws is a great way to kind of come to that, you know, what might be the best.
Danielle, that's thank you for adding that. Yeah, I think you guys personally, I carry the bylaws around with me when I come to these meetings. I've got my folder and I've got all the stuff in there. This can inform our bylaws. We can change our bylaws. But we need to kind of figure this stuff out in order to do that. And then the bylaws can inform what we can do here. So she's absolutely right. It's a great point. So being familiar with our bylaws is important. That governs how we do things. And we can easily make changes to that. I think that the last change to the bylaws was maybe 3-4 years ago. I think they did some work. So I think definitely when Roger was,
But it was nothing big.
and Jessica, yeah. So the bylaws talk about how many meetings we have to have a year. That's where the requirement of 50%, I believe, 50% of our members have to have lived experience comes from. And so it's important for our group to all know what's in those bylaws. Linda has her hand up as well. Linda?
Would it be possible to send those out? I may have had a copy of the bylaws at one time, but I have no clue how to go find them. And so would it be possible to go ahead and just electronically send those to all of us again?
Yeah, Dana can do that. You can do that, but also just so you know, you can go to the Deschutes County website and you can go to the behavioral health section of the Behavioral Health Advisory Board. There's a tab for that. And if you go on that and scroll down, you can see I think our meeting minutes are posted up there, and definitely our bylaws are posted, and our meeting notices. And so you can always find them there, but Dana, if you wouldn't mind sending out the bylaws to everybody, that would be super helpful.
Can send the link to the
We're
website.
doing website redesign too, so that's gonna change, but
So get into it quick.
But
Okay.
I just wanna give you extremity
I
issues,
understand.
don't freak out and be like, I couldn't get to them, just.
Okay, fair enough, but
You can
But
always email me.
there will be a
new
tab,
one, right?
there will be a tab for
Yeah.
our board. And that's where you can find links to these documents for future purposes.
And will that include all the current members where they work, what their title is? Is that
It
up to
doesn't-
date yet?
It
Okay.
doesn't, we currently don't have a list on there. The Public Health Advisory Board does have a more formal list. Their membership is different. They voted to have specific positions to fill. So for example, I off the top of my head, I can't think, but they've got somebody from St. Charles. And so they have specific positions that have criteria. We're more loosey-goosey, like,
Well,
Okay.
not just loosey goosey, but we have members who have lived experience and then conversation has come up that we don't all want our names out there. Saying that we have children or
yes.
parents or loved ones, who are accessing mental health.
Well, can that information be released to us since we have a vested interest in knowing who's on this and what agencies they work for?
It's not that, I don't think you're talking about the list itself. I mean.
No, who we are,
Who
but
is on our board is a matter of public interest and it's yeah, so names and, maybe where they work or,
it's on all
some.
of our minutes.
Yeah, the meeting
Well,
minutes
I'll
are
make my
there.
request a little more personal, a little more simple. I don't have a clue who most of you are and what your names are and where you work. And I've been coming to meetings for about 6 months.
Well, that's why we spend quite a bit of time at the beginning of each meeting on introductions and one interesting thing, and I know that. In the fall, we talked about who we are and so that's kind of the goal of that agenda item is to get us to know each other better. We did have some materials that were distributed about who we are. That has not been updated as far as I know for 2 or 3 years. I don't know if we want to, given the budget crunch, I don't know if that's something we want to do is to have like a nice glossy with our photo headshots and all that. Personally, I think it's a little bit overkill,
Yeah.
but what we could do is circulate a list of who we are and our contact information and what our role is, like some background, some kind of one-liner bio thing about why are we here? I'm here because I work with school districts. And I do a lot of.
I wasn't thinking of anything elaborate or glossy, but just, I can see the pictures of the people in the room, but you don't have a name attached to your face. I can see it online. So, it's not a complaint, but if we're going to be working together on what is our purpose and how are we going to work together and how are we going to interact and who does what and who do we serve, it's nice to know what the inventory of talent is.
Yeah, and like I said, and the only reason I brought up the glossy, I know that's not what you're asking for, but I'm just saying that we have materials like that. They're just out of date. And we as a board need to make a decision about what that looks like, if we're gonna put a lot of effort into that, or if we're just gonna have a list and continue with our introductions at the beginning of each of our meetings. So, but your point is well taken, and I do think we need to have updated lists. There's been a lot of change since Lee and I have been appointed chairs and people coming and going. Now Captain Schultz is leaving. And so it does take some effort to keep those lists up to date. And we're hopefully going to be adding somebody. By the way, we do need to continue filling our roster.
I didn't mean that as a criticism or a burden.
I know.
It could be as simple as put a sheet and let everybody sign it, electronic or otherwise. Where do we work? What do we do? And it wouldn't have to be fancy to be functional.
Yeah, got it. Okay, thank you. I think that's really valuable input. Thank you, Linda. We will work on keeping a roster, but if you guys know anybody that might be interested or might be a good fit for our group, please forward to Cameron and Stephanie, one of them, or even Lee and I, their names. We really want to be active in having a really good, well-rounded group. And we have some positions to fill, at least one now. Okay. All right, so please take a look at the bylaws. Please take a look at the menu of future potential directions. And so for the February meeting, come prepared we're going to focus on that as our discussion.
Just one more note, kind of a roundtable thing. Commissioner Chang is chair this year of the Board of Commissioners, and he started off saying that he'd like to have the advisory committees invited in for an update sometime during the year. So this is January, but yeah, in the next some number of months, maybe this group or a subset of the group can come in and explain what we're doing.
That'd be great. We'd
Maybe
love
we'll
to-
see you in person, Linda.
Yeah. That'd be great. Should we wait for an invitation from you?
Oh, yeah, it's a good idea that was dropped, so yeah, we'll look at the schedule and put things out.
All right. Anything else for the good of the order? All right, this meeting's adjourned. Thanks, everyone.
Carl's or anything?
Oh, I don't know, yeah, Tom will know.
Okay.